Hello, I'm Steve Helms. As I've gone door to door during this campaign, a few individuals have suggested that we should expand Medicare for all. The reasons they say are that Medicare is more affordable, pays less for more services, and has a lower administrative cost when compared to private health insurance plans. First, the reality is that when you figure in the true cost of Medicare, it isn't more affordable. For example, the largest part of Medicare is funded over the working life of a person who receives no benefits during this time. In 2016, Medicare puts the value of that contribution period equal to $411 a month. With the Part B premium, that would bring up the individual cost of Medicare to $532 per month, or around $6,400 for one person. According to the Kaiser Commission on Medicaid, Missouri spends around $6,400 per person as well. Not to mention the fact that original Medicare still has high deductibles, co-pays, and there is no cap on the maximum out-of-pocket expense. This in comparison to the average cost of the private insurance plan of around $5,011 per year per person. The second reason stated is that Medicare pays less and gets more services. Well, yes, Medicare does use its large purchasing power to get a better price break, but regardless, government can't dictate the true cost of any product or service. When Medicaid lowered its reimbursement rates too far, it found that insurers and providers refused to take patients or saw fewer of them. This hurt patient care. The bottom line is that no one can give services away for less than it costs to provide those services in the first place. And finally, they argue that Medicare has a much lower administrative cost than does private insurance. This is true. However, the higher administrative cost serves a valuable service, such as providing targeted use of its resources through case management, while still delivering a high quality of care to its patients and eliminating a lot of waste, fraud, and abuse. Medicare, on the other hand, is estimated to lose a whopping $60 billion a year to fraud. That's incredible. The government itself realizes that the private sector does a much better job of delivering healthcare services while reducing waste, fraud, and abuse when it created the Medicare Advantage program. This is where private insurance companies contract with the government to provide all the original Medicare benefits plus extras, and often including drug coverage and placing caps on what a person might pay out of pocket. But even with that, Medicare beneficiaries still have options, and that is just to keep plain original Medicare with nothing or use Medicare with a Medicare supplement. What this means is that Medicare for all wouldn't work, nor is it truly a single-payer system, because many, if not most, Medicare enrollees pay additional premiums to make the system work. Because of these market forces, Medicare works better. But Obamacare is reducing the market forces in our healthcare system and taking choices away from patients. That's exactly the opposite path that our state and nation should go. What we can do, though, to begin to fix our problems with healthcare at the state level is to resist expanding Obamacare. While it fixed a few problems, it failed in its biggest benefit, and that was to reduce the real cost of healthcare. Plus, every dollar of Obamacare expansion is being added straight to our national debt. No one is tearing up a check or giving away free money. Second, we need to inject more market reform in the system by requiring transparency in pricing and expanding direct primary care. And third, the state of Missouri, through interstate compacts with our neighboring states, should allow insurance companies to cross state lines. We don't need another massive expansion of the federal law. We need them to give up more control that they should never have had in the first place. There are a lot of other reforms that are being talked about, but a federally driven single-payer takeover of our healthcare system will only give us healthcare with the compassion of the IRS and the efficiency of the DMV. I've received care from government-run single-payer system as a soldier. Sometimes that care was good, and other times it was not. It didn't matter what I wanted. I'm Steve Helms, and I want to go to Jefferson City so we can truly bring down the costs of healthcare and make Missouri a great place to live, work, and raise a family. Thank you.
Paid for by Friends of Steve Helms. Thomas Fowler III, Treasurer.